Hypertension is a significant risk factor for cardiovascular diseases and affects a substantial portion of the adult population, over 30%. Secondary hypertension refers to elevated blood pressure that arises from an identifiable underlying medical condition. It is estimated that 10% of individuals with hypertension have secondary hypertension. Accurately identifying and treating the root cause of secondary hypertension can potentially lead to a complete resolution of the high blood pressure, eliminating the need for ongoing antihypertensive medications. Several clinical presentations should raise suspicion for secondary hypertension. Resistant hypertension is defined as persistent elevation of blood pressure above 140/90 millimeters of mercury, despite the use of at least 3 different antihypertensive medications from different drug classes, including a diuretic. A sudden and rapid increase in blood pressure in a patient who previously had stable blood pressure readings should also prompt consideration of a secondary cause. Other red flags include the development of hypertension in non-Black patients before the age of 30 years, without the presence of additional risk factors such as obesity or a family history of hypertension. Additionally, individuals presenting with severe hypertension, defined as blood pressure exceeding 180/110 millimeters of mercury, or those exhibiting evidence of end-organ damage, should be evaluated for secondary causes. The presence of electrolyte disturbances, specifically hypokalemia or metabolic alkalosis, in association with hypertension may also suggest an underlying secondary cause. Furthermore, the onset of hypertension before puberty or unusual patterns observed during 24-hour ambulatory blood pressure monitoring, such as the absence of the typical nighttime dip in blood pressure or a reversal of this pattern, can point towards secondary hypertension. Common causes of secondary hypertension. Renal parenchymal disease, encompassing a range of disorders affecting the kidney tissue, stands out as the most prevalent cause of secondary hypertension. These conditions include diabetic nephropathy, glomerulonephritis, and polycystic kidney diseases. Renal parenchymal diseases contribute to secondary hypertension in approximately 3 to 5% of individuals diagnosed with hypertension. The likelihood of secondary hypertension increases as kidney function deteriorates. More than 2/3 of patients with advanced chronic kidney disease have hypertension. Endocrine disorders, characterized by hormonal imbalances, represent another significant category of secondary hypertension. Among these disorders, primary aldosteronism emerges as the most common, accounting for up to 5% of hypertension cases. In primary aldosteronism, excessive production of the hormone aldosterone leads to sodium retention and fluid volume expansion, thereby contributing to elevated blood pressure. Other endocrine causes of secondary hypertension include pheochromocytoma, Cushing's syndrome, acromegaly, and thyroid disorders, although these are less prevalent. Renovascular disorders, specifically stenosis or narrowing of one or both renal arteries, account for about 1% of patients with hypertension. In older adults, atherosclerosis is a frequent culprit behind renal artery stenosis, whereas younger individuals, particularly women, may develop renal artery stenosis due to fibromuscular dysplasia. Vascular disorders can also lead to secondary hypertension. Coarctation of the aorta, a congenital narrowing of the aorta, is a notable cause of secondary hypertension in young adults. Obstructive sleep apnea, polycystic ovarian syndrome, and certain medications can all elevate blood pressure. Drug-induced hypertension is a significant consideration, with medications like nonsteroidal anti-inflammatory drugs, NSAIDs, decongestants containing phenylephrine or pseudoephedrine, and corticosteroids being common culprits. In younger adults, excessive alcohol intake is a prominent cause of secondary hypertension. Similarly, birth control pills can lead to hypertension in younger women. Evaluation of secondary hypertension. The diagnostic workup for secondary hypertension should be tailored to the individual patient, taking into account their medical history, physical examination findings, and the suspected underlying cause. When renal parenchymal disease is suspected, initial screening tests typically include blood tests to measure serum creatinine and estimate glomerular filtration rate, (eGFR), along with a urinalysis to assess kidney function and detect any abnormalities. Additional tests may involve measuring urinary protein levels and performing a renal ultrasound to visualize the kidneys. For suspected primary aldosteronism, the plasma aldosterone-to-renin ratio is the preferred screening test, particularly in the presence of hypokalemia. This test helps to determine whether aldosterone levels are inappropriately high relative to renin levels, suggesting autonomous aldosterone production. If pheochromocytoma is suspected, measurement of urinary or plasma metanephrines is recommended as a screening test. Elevated metanephrines, which are breakdown products of catecholamines, adrenaline and noradrenaline, can indicate the presence of a pheochromocytoma, a tumor that produces these hormones. This suspicion is further heightened if the patient experiences episodic hypertension accompanied by palpitations and headaches. An overnight dexamethasone suppression test serves as the initial screening investigation for Cushing's syndrome. This test assesses the body's response to dexamethasone, a synthetic corticosteroid. In individuals without Cushing's syndrome, dexamethasone effectively suppresses cortisol production. However, in those with Cushing's syndrome, cortisol levels may remain elevated despite dexamethasone administration. Renal Doppler ultrasound is the recommended screening test for renovascular hypertension, particularly when there is uncontrolled hypertension, a brood herd over the renal arteries on auscultation, or worsening renal function observed after the initiation of angiotensin-converting enzyme inhibitors. Renal Doppler ultrasound evaluates blood flow in the renal arteries, helping to identify any areas of stenosis or blockage. Complications of secondary hypertension. Secondary hypertension, like essential hypertension, increases the risk of serious health problems such as heart disease, stroke, kidney disease, and vision problems. If left untreated, secondary hypertension can lead to severe and potentially life-threatening complications, including resistant hypertension, accelerated end-organ damage, and increased risk of premature cardiovascular events. Unlike essential hypertension, secondary hypertension has an identifiable cause. Early identification and treatment of this underlying cause are essential for effectively managing blood pressure and preventing complications. Prompt diagnosis and treatment can significantly improve outcomes and reduce the risk of serious health consequences associated with uncontrolled high blood pressure.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.